We're joined now live by Azar. He is the Secretary of Health and Human Services. And Secretary Azar, always appreciate you taking time to speak with us, especially when it comes to the vaccines on the heels of Victor Oquendo's report right there. The CDC, according to the CDC, 13 million doses of the vaccines have been administered so far. That is, as you know, less than the goal of 20 million. What are the reasons for the delay, sir?
Well, Robin, thanks for having me. And, as you know, the FDA approved these vaccines just in the days before Christmas. And what we said our goal was actually to have 20 million first doses available in the month of December. Those are available, but there's a lag between doses being available, them being ordered by the providers and the states, shipping, and then eventual vaccination, especially when you have Christmas and New Year's in the middle. We've seen a very rapid uptake just in the last 72 hours of reporting, 1.5 million additional administrations of the vaccine. And working with our states, I'm very hopeful that we're going to see a continued rapid uptick in that. As Dr. Fauci talked about, this is just, it's normal. This is the largest vaccination campaign in the history of the United States. I'm actually surprised there haven't been more glitches than we've seen so far. Our states are on it. We're working with our governors. We're providing them help.
And it is promising what we have been seeing in recent days. I want to ask you about a couple of strategies that are out there. One was floated by your chief science advisor for Operation Warp Speed, and that was to give half doses of the Moderna vaccine to some recipients in the future group. And there was another strategy floated as well to give everyone just one dose before being concerned about the second dose. What do you think of those ideas? As to the first idea regarding dose and dosing strategy, we go with the data and the science. So the clinical trials, which is the gold standard, had administration schedules and dosing requirements. That's what the data supports at the FDA. If different data is generated supporting different dosing or dosing schedules, and the FDA approves it according to gold standard, then that's what we're going to do. But we're going to stick with the data that we've got. In terms of dosing a first dose without a second dose available, that's just not in the label. That's not what the data supports to go out and vaccinate a lot of people with a first dose, knowing you won't have a second dose for them. The data just isn't there to support that, and we're not going to do that. We're holding in reserve that second dose because we believe we need to go according to what the FDA has said is the safe and effective way to use these vaccines. What about additional vaccines being approved? We saw in the UK this morning that they just started administering the Oxford vaccine, which is in phase 3 trials here in the U.S., along with 2 other vaccines. So when do you feel the additional vaccines will be available here in the U.S., sir?
Well, we could see data from the Johnson & Johnson vaccine, which is a single-dose vaccine, very exciting, as well as the AstraZeneca Oxford vaccine, really any time now. Unfortunately, as you noted in the opening, we have so many cases in the United States. We don't want that, but that actually does speed these vaccine clinical trials. We could see data any time, and when that comes out, it'll go to the FDA for review, and then we actually initiated a fifth phase 3 clinical trial for Novavax, so we now have 5 vaccine candidates. At
least 5. All right. Secretary Azar, again, thank you very much for your time. No, everyone is working around the clock. We appreciate it, sir. Take care. Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.